Hi Gregory, good morning. Good morning everyone. It's my great pleasure to have Professor Gregory Kaltsas with me today for an interview. We are at the moment at the Portuguese Congress of Endocrinology in Coimbra. It's a very historical city. I hope you enjoy a bit of time here. So Professor Gregory Kaltsas is well known to all of us. He's a recognized Professor of Endocrinology and Neuroendocrinology. Is head of the EKPA-LAIKO ENETS Center of Excellence in Athens. Gregory is also an outstanding collaborator with ENEA. Has been a past active member of the EXCO committee and of course a regular face in our ENEA meetings. Gregory also serves as a chair of the Education Committee at the European Society of Endocrinology, and is also an EXCO member at the ENETS. Gregory, thanks so much for your availability for the interview.
Thank you very much, Pedro. My pleasure to be here and see this particular part of Portugal that I have not been aware before. Thank you for inviting me.
Thanks so much. So my first question, we are going to focus on one of your areas of interest, which is the Langerhans cell histiocytosis. I recently published several interesting papers. I just wanted to start, what are the main features of the pituitary hypothalamic involvement in patients with histiocytosis?
Yeah, thank you very much. That's a very interesting question, and apparently this was an interest of mine that became apparent when I was working at Sir Bartholomew's, when we were asked to publish a paper on patients with hypothalamic-pituitary involvement of histiocytosis, Langerhans cell histiocytosis, which is called LCH. This is a rare disease. We have done an epidemiological study in Greece and it's less than 1 million incidents. And it's a monoclonal disease that is secondary to the proliferation of the dendritic cells, which they derive from the bone marrow. And they're distributed throughout the body and they can cause problems to many organs, mostly the skin, the lungs, the lymph nodes, and the central nervous system, among these the pituitary and the hypothalamic pituitary axis.
Okay, interesting. And in terms of the main developments, in terms of, and challenges, in terms of diagnosis and management?
Yeah, some time ago, the only treatment of histiocytosis, which is a disease that's mostly encountered in children, but these children grow up and they become adults. There were no guidelines in the management, particularly of adults. So we were following the protocols that they were initially produced from children. They were basically based on chemotherapy and glucocorticoids. Nowadays, we do know that a significant number of patients with LCH, they have specific mutations that they affect the RAS MEK/ERK pathway, and they have mutation of the BRAF. So we have now inhibitors that they can inhibit BRAF and MEK pathway. So the latest guidelines have incorporated these modalities in the treatment of patients with LCH.
Yes, thanks. It's a really exciting new developments.
It's very important to know that because as endocrinologists, we face that, particularly when we have lesions that they affect the hypothalamic pituitary areas, particularly they have a thickening of the stalk, affect the nucleuses of the hypothalamus and even the pituitary, and they develop endocrine deficits like diabetes insipidus and adrenopituitary hormonal deficits that unfortunately are permanent. So we have to replace these patients lifelong.
Mm-hmm. So of course treating the hypopituitarism, but also of course treating the condition itself. Okay, really nice. Thank you for the nice insights. Moving now a bit more to the career and work-life balance questions. I think the first question I would have for you, it's if you have an advice for us, early career scientists and endocrinologists, how to become a distinguished professor in the field of neuroendocrinology and pituitary?
I think that since when I was a trainee, things have changed. At that time, we were focusing mainly on developing clinical skills. But in nowadays, these things have evolved, so I think that in order to be successful in your area of expertise, you need to have some basic knowledge as well, and you have to expand on clinical skills and education, and then try in interfering and promoting all these issues to your patients, to your colleagues. So I think you need to have and try to improve all these skills in order to create the background. And after that, in going into the organization field, then you have to liaise with other specialties, because nowadays all these kind of lesions and diseases are dealt in a multidisciplinary team. So particularly in the pituitary field, you have to engage patients and then you have to engage physicians that they have an interest in endocrine diseases, and physicians that they do promote other medications as well, and radiologists, neurosurgeons, nuclear medicine. So you have to have a very established MDT that takes the proper decisions for the management of the patients. And this is particularly relevant not only for the pituitary tumors, but for the other neuroendocrine tumors, where the input of oncologists is definitely needed as well.
Okay, so I think one of the key takeaways that as early careers try to get involved as much as possible and the earliest possible in multidisciplinary teams, rather in the clinical setting, but also in the research. Also, research and clinicians should talk and.
Yeah, I think that now we're going to personalized medicine, so I think that basic information about the molecular pathogenesis of the disease is very important, because by going to personalized medicine, you promote and induce the right treatment with less side effects.
Okay, yeah, very, very good tip for us, all of us. Even more established endocrinologists and professors, but of course for early careers, it's very important to be involved in a thriving, multi-center, multidisciplinary settings and networks.
I think this is the way forward.
Yeah. And one tip about how to balance the best work and the private life.
Okay, I was hoping you're going to give me this tip, because it's very, very difficult to do that, and everyone, has to find sometimes to get some type of pressure because you are involved and engaged in all our daily duties. But I think that you should try and keep some time and take some breaks, even if you are overwhelmed with commitments, because then you lack of energy and then your performance drops. And sometimes you have to say no, I think, when you are overwhelmed with commitments, and just select the ones that they are more appropriate and more useful to what your process of thinking is and your commitments. So I personally try to have some time with my family, and with, to be honest, I haven't devoted the time that I should have done to my children. And personally, the only way I find out to try and get my mind out of medicine is to do some kind of jogging.
Okay, okay. No, it's very important that we need to say no in the right times, to have the time to have for a very other important elements, to keep energy for the in a win-win situation, both dimensions.
Very important.
Yeah, yeah. Well, I can't resist. Like, you just had a brilliant talk was on pancreatic neuroendocrine tumors. I must ask, like, what are also your insights about the advances and the management of this challenging condition?
Okay, these are rare, relatively rare tumors, but they are fascinating because they have very distinct clinical pictures. So I think it's very important to be able to recognize the clinical presentation. And then there are specific treatments that you can offer to patients. But if you have more disseminated disease, then you have to be familiar with the more complex treatments that these patients need. And this can be done on a multidisciplinary team rather than on a physician acting on his own.
Okay. Yeah, the MDT again, the importance of collaborating, bringing the different expertise together to really enhance the care for these cases.
Definitely.
Yeah. Well, Gregory, thanks again for your availability and for these very useful insights to all of us early career endocrinologists, scientists, basic scientists, other field doctors and scientists. And it's really a pleasure to have you with us here in Coimbra, and I hope you have a good time here. and stay tuned. Like, there's a lot going on in all these areas we just discussed, and thanks again.
It's been my pleasure being here, and thank you very much for inviting me. It's an opportunity to meet all these people and interact with them and with you, because we are in very close contact all this time. Thank you.
Thank you.